This committee has jurisdiction over employer-sponsored health insurance. I know there are some that believe we need to move beyond the employer-sponsored coverage. However, the employer-sponsored system currently provides health insurance for over 181 million Americans. So instead of forcing Americans off their plans that they like, or in the cases of union employees, forcing them to give up health plans that they worked hard for and made salary sacrifices to negotiate, we should explore ways to strengthen our employer-sponsored system, reduce costs, so more businesses can offer these good benefits to their employees. I constantly hear from small employers in Michigan who are dealing with the cost and compliance burdens of providing health insurance coverage to their employees. While some small businesses are able to offer health coverage, many simply cannot afford to do so. One option among others, which was passed by this committee, is for small employers to band together to provide economies of scale for purchasing health insurance through an association health plan. Ms. Turner, thank you for being here. As you know, in August, the Department of Labor issued a final rule to expand access to AHPs. In your opinion, when finalized, will DOL's rule help or hinder efforts to increase coverage for small employers and their employees?
It absolutely will provide them an important new option to negotiate benefits on behalf of their employees. Talking with another HR director who has a workforce of primarily medium and lower income workers, he said what happens is that as healthcare costs go up, it eats up their wage increases. So employees see their wages as flat, but part of their compensation, because too much of their compensation package is going to health benefits. Some employers are very creative, helping to provide coordinated care for people that they've identified that they have the greatest health care needs. So I think employers play an important role, and I think association health plans also play an important role, as well as the new health reimbursement arrangement rule, which would allow employers who can't afford and don't have the resources to actually provide coverage to give their employees a stipend to be able to purchase health insurance on their own. We've recommended they be able to combine salaries from two spouses, for example. One spouse may be offered health insurance at work, the other one can get a stipend to help make that a family plan rather than just an individual plan.
The beauty of more flexibility, creativity, and options that go on.
And also to recognize the competition out there. Right. Plans are competing, companies are competing, everybody's trying to do the best job to get the best value. You
mentioned in your testimony a study by Kev Coleman, a former analyst at the insurance information website, Health Pocket. In his study, what type of plans did Mr. Coleman find that AHPs were offering? And let me ask this as well, are essential benefits covered in the plans that he discussed?
His study by Kev Coleman showed that these AHP plans are offering benefits comparable to the largest employers that have negotiated these benefits for years, and that they are not discriminating against patients with pre-existing conditions. Many of these employers may have someone on their staff, maybe even a family member that has a pre-existing
or themselves.
condition. Yes, and so they want those benefits, and they're really pressing the market to figure out how do you do that at a price that they can afford to purchase that coverage.
Thank you. I yield back.